so I have to run fast. And sir, the WHO standard, it says that it's very, very important. The patient-doctor population, it must be 1:1,000. That is what the WHO recommends. Let me tell what is the situation in India. It is 1:1,272 average. But state-wise, I'll go. Uttar Pradesh is 3,767 per doctor. Jharkhand is 8,180 per doctor. Haryana 6,037. Chhattisgarh 4,338. And I will not rush up. I will rush up with everything considering the time. Kerala is 535 per doctor. And Tamil Nadu stands number 1, 253 per doctor. Sir, why? How it is possible? See, when one part of the country, when 4,000 persons are depending upon one doctor, you are not increasing the health workers. They are not being taken care of as they should have been. But actually it is not so. And another very important thing is the non-communicable diseases. Because of the non-communicable diseases, what is happening is, non-communicable diseases are like diabetes, cancer, and pulmonary diseases and all other things. Because of that, probability that a 30-year-old dies before the age of 70 due to this NCD, that is non-communicable diseases. In Japan, it's only 8%. Out of the total deaths, the deaths because of NCD is 8%. UK is 11%. USA 14%. Brazil 15%. China 16%. Bangladesh 18%. Vietnam 20%. Malaysia 22%. India 24%. Again, I feel sad and sorry to say all these things. The non-communicable diseases are not brought under control. Whereas Tamil Nadu, what it has done is, I will rush up with bullet points. Tamil Nadu diabetic food care policy, because it is one of the non-communicable diseases. And mental care wellness. In India, it is 0.07 per 1 lakh population, the psychiatrists are there. They are not taken care of. It's a very important. Mental health and wellness is very much important. Whereas in Tamil Nadu, we have got Natpudan Ungalodu Mananala Sevai. So we are taking care of those who are mentally ill. And Punnagai scheme, that is about smiling. Punnagai means smiling. Aims to ensure the dental health of students by providing dental treatment and creating awareness about one disease. And anemic. Anemic is spreading to the alarming level in India with pregnant women and children. So what has been done towards that? The Tamil Nadu government across India, it started from Tamil Nadu and now implemented all over the nation the midday meal scheme. But only in Tamil Nadu, we give breakfast also to students of primary school because they should not suffer from anemia. And this is being followed by other states like Kerala also. Yes, sir. Kerala also following. So southern states always stand first. That's why we are victimized. That's why we are penalized. For everything, we are not taken care of. We are not being ignored. We are being ignored for the way we are performing very well. We have never heard that an outstanding student is punished anywhere, sir, only in our country. This government is with a stepmotherly attitude and partiality looking into it. Strong public health infrastructure we have. We have got a strong focus on preventive care and community health services. Where many PHCs across the country, what the union government should do is it should focus on those states where the things are getting worse. Whereas we are doing very well. The PHCs are more in number. The community medical center, health centers are more in number. The secondary, tertiary hospitals are providing the best health. We go to the people where they live and give service. So the states are doing their responsibility and performing very well, whereas the union government is not focusing on the states that are not performing well, rather they try to punish us. That's what I say. Whatever is responsible with the union government, you say that first you increase the budget. With that budget allocation, you have to do the needful. But that is not done so. No research. Without research, medical advancement cannot be. You cannot be depending upon other countries for technology development. Sir, I got very important concerns because I think you have to give me some minute or two for more. The health insurance, you have got one scheme, what is that, Pradhan Mantri Ayushman, and the state government has a different, the Chief Minister's health scheme which gives 5 lakhs to people, that's all different. But the saddest part is the minister should take it into consideration. Excuse me, only the MOs is here, don't disturb them. What is, take care, please ma'am. When we are talking much about the insurances, the term insurance, health insurance and life insurance premiums are taxed at a steep 18% GST, the highest. Treating them as luxuries rather than necessities. How sad it is. Health insurance premium is charged at 18% GST. And out-of-pocket expenditure. The middle class people are too rich to get any aid from the government and too poor to spell out from their own pocket. And another thing is toxic air. India has some of the world's highest rates of lung disease. And aging population, the TFR, and it is increasing alarmingly, enormously this side, but in southern states it is under control, the total fertility rate. And very importantly, I would urge the health minister who is here to take into consideration 2 things. One is this insurance premium should not be charged at 18% GST. Another is one paraquat poisoning. It is available very freely. If anyone consumes that, even medical intervention cannot save them. I think the ministers are very much aware of it. Already the European Union, China and UK have banned that. Only India is having that. The poor people who get frustrated in life, who cannot resort to anything when they try to commit suicide, at least to frighten their family or anyone else, they resort to something. So they get the rat poison, which is very easily available, and this paraquat poison, which is very much easily available, and they are not at all able to be rescued. They get worse. They cannot be saved on one hand. They deteriorate in the worst manner that no patient should suffer. And so I urge the ministry to ban this paraquat poisoning and rat poisoning in the concern of the people. The common man, the poor man in this country, whoever is attempting to commit suicide, they are very easy. It's a herbicide. It's a herbicide and very easily available. And this is not just a suggestion from the ruling party side. I am speaking on behalf of the people who are suffering at the hospitals because of committing suicide. And the most important is the aims at Madurai in Tamil Nadu. It was announced in 2018 with a proposed completion by 2022. The project remains in limbo with only excuses and shifting deadlines. Whereas at the same time, some aims have been announced to various other states and all have been completed, all have come to functional. That's why I say don't look with a partisan eye the states. You have to look all the states as one. I have repeatedly told we consider that we are a part of India and the union government has to consider the state of Tamil Nadu as a part of India. And so also healthcare is not a very easy thing. Many are suffering, not able to get a quality access to quality care because of the hospitals. In Tamil Nadu, 50% is government hospitals, 48% is private, whereas in other parts like Uttar Pradesh and all, only 26% are government hospitals. So the government hospitals are not so easy. Anyone who has got an opportunity, please come and see the hospitals, the government hospitals in Tamil Nadu, the best ever. Nobody will go to a private hospital if they enter into the government hospital. So also all the schemes we are implementing before prevention is better than cure. That is the policy what we are implementing. Kindly take Tamil Nadu as a cue and implement it across the nation. And I urge the ministry to increase the budget and especially the GST must be reduced. Thank you very much. Thank you very much.
I now call upon the members